Okay, our next speaker is Juan González from InsightMedi, and Juan will talk about InsightMedi and its quest to analyze the largest database of medical images, challenges, benefits, and collaborations.
Thank you. Good afternoon, everyone. My name is Juan, and I'm one of the co-founders of InsightMedi. First of all, I'm really happy to be here today, have the opportunity to talk to you. Particularly today, I'm going to talk about our company and its quest to build and analyze the largest database of medical images. Some of the challenges that it brings, the benefits of pursuing this idea, and the importance of collaborations while trying to do such a thing. The first half of my presentation is going to be about the company. Industry so far is known for everyone. This is not the case. We're a very small company, so I'm going to introduce you to what we are today. The second half is going to be the company that we want to be in the future, our vision. So we're a startup from Spain. We were created to foster healthcare community by providing innovative ways to expand, share, and improve their knowledge. This is our mission, and everything we do is associated to solving the problem of sharing information in this very tricky environment filled with strict rules and regulations, which is healthcare. So let me tell you a little bit more about why we do the things that we do at InsightMedi. So today, 90% of healthcare personnel uses a smartphone for any work-related activity. Over 65% of doctors use it specifically to take clinical images. And you might be surprised to know that in a recent study, more than 40% of healthcare providers interviewed admitted to have shared these images on regular social media. They do it using WhatsApp, they do it using text messages, and this is, of course, far from ideal. But we understand why this is happening. There are two main reasons why the medical community needs to share. The first one is consultation, this ongoing quest when trying to find out what's wrong, to reach a diagnosis. The second one is education, because they not only want to be better at what they do, they want to excel. And we admit and we know that there are different ways to achieve these goals. But a medical image is by far the most effective channel to do this. They can tell a very complex story, and they know no barriers of language or location. At InsightMedi, we know there's a growing need for consultation and education tools that take advantage of the process of sharing. But sharing in healthcare has an added complexity related to privacy, security, and international rules and regulations. So it's very tricky to do. This is why the tools that we develop today need to be sophisticated enough to take advantage of the whole process of global sharing, but without compromising security. And this is our product. This is why we created InsightMedi. InsightMedi is a mobile platform that has been designed to promote sharing medical images while protecting the patient's privacy from beginning to end. We have created this tool to allow healthcare professionals to use the tools that they need to keep improving the quality of care, but without the risk of personal or institutional liabilities. Even though InsightMedi's core is the medical image, we always keep proving and testing and experimenting. So thanks to a partnership that we have with a US company called RealDx, we just introduced videos, clinical cases based on video tool for our audience. So we provide access to a wide library of video cases, all recorded by physicians and for physicians. So it's very interesting. We're a very truly global community. We're more than 22,000 healthcare professionals and medical students coming from more than 80 countries. Our platform is compatible with more than 160 languages because we want to extend the universality of the image to the debate, the written word in our platform. This is the team that is making it all happen today. Gonzalo and Gabriel, they're both practicing physicians with more than 20 years of experience and a key role in the curation of our content. Jordan, she is in charge of marketing efforts and the growth of our platform. Abder, I'm really sad that he couldn't be today, but he's the brain behind the other half of my presentation. So he leads the research and development efforts. While Luis and I, we focus on developing the platform and driving its adoption worldwide. So just to finish with the first half of the presentations, I want to mention our partners, because without them we couldn't do what we do. Both in Spain and the US, they help us achieve our goals, and we count them and we consider them as assets when we bring them into a collaboration deal. So that's InsightMedi today. This is the company that we have. This is the company that we are. So how do we see ourselves in the future through the efforts of R&D? One of the main challenges that the physicians have today, and it's been said many times over, is the increasing amount of patients needing healthcare services. More patients means there's more health data to be processed. And then there's always a pending, there's always the urgency to come up with a diagnosis in a short amount of time. We have identified this as an opportunity to process this massive amount of data, especially the data that is coming from medical images. This is where we want to focus on. So this is why we're laying out the foundations to build the largest database of medical images known to man. Our community today, and we were talking about how do we access, how do we get the images. Our community today is an active channel of crowdsourced medical images that is being provided to our platform 24/7, 365 days a year, willingly. But we know that acquiring the data is just one part of the puzzle. We also need a feasible strategy to process this information, and then, in our case, because we are industry, to chip it in a product that we can put in the hands of thousands of healthcare providers. So this is why we are thinking about a combination of fuzzy logic and deep learning techniques to extract and represent knowledge from these images. This is the plan that we have put in place. This is the idea that we have. We know that using machine learning, we're able to increase the productivity of the doctors while improving the quality and the outcomes of the care and the attention. So we recognize that this is a grand challenge problem. So this is not an easy thing to do, especially for a small company like ours. But we have thought long and hard about it, and obviously we have a plan. We know and we recognize the key role that institutional collaborations have in this thing that this goal that we have, right? So institutional collaborations is a very important part of what we want to do. This is why we're here today. The whole second part of this presentation is an invitation to you. So we thought, okay, let's go and reach out to institutions and see what they think. Maybe we're crazy, maybe this makes sense somehow. And I could say that initial response couldn't be better. We have talked to some of them, we have promoted this idea, and we're working on creating an agreement that we can then present to them, present to you, so we can work and revise on an individual basis. And to get a little bit more into the detail of what I'm talking about, let me just pick randomly one institution and focus a little bit more on it. Usually a great partnership starts with the contribution of with complementary skill sets and the contribution of and a group of valuable contributions from each side. So this is a great partnership. Established institutions like the University of Cambridge will usually bring resources like the Center for Mathematical Imaging in Healthcare, workforce skill developers, its own database of images, and its own institutional relationship. This is clearly very valuable for anyone. A company like InsightMedi will bring also a platform that is stable, that has been developed and tested for years now, its own database of images, a captive audience all over the world where you can test what you do, a workforce of developers, although smaller, and the partners that we mentioned before, partners as important as the University Johns Hopkins, for example. So the synergy clearly comes from taking advantage of each other's strengths and working together under an agreement that is clear towards solving one particular problem at a given time. It could be diagnosis of melanoma, it could be lung cancer, heart disease that we talked, many of the ones that we've talked before. So it wouldn't be crazy to assume that the strengths of each institution, in case of the university, could be in the quality of the data that they're providing and how skilled the workforce is, PhD students, professors, obviously. Also, how to protect IP, how we protect what we do. And obviously publishing, right? Writing papers. This is a no-brainer. A company like ours will bring a fast development cycle that can put whatever we develop together in the hands of thousands of people around the world. So we can test what we do, we can measure the impact of what we do, and we can analyze it. So we can keep improving it, and we can keep writing papers and publishing. So it is a beautiful synergy as we see it. Now, let's zoom out a little bit for a second, and then imagine with this mindset, with this approach in mind, that we will replicate the same experiment with all the institutions that are willing to participate in this idea. And this is how we do it. This is how we go from a big database of images, from the contribution of our current community, which is always growing, and the contribution of a new collaboration partners. We build the largest data set of medical images that has been ever created. This is the way that we think we could do it. Always in mind, having in mind that we're going to use deep learning to extract and represent information from medical images to improve increase the productivity of the healthcare professional while improving the outcome of the patient. So that's our idea. Thank you very much.
Thank you very much, Juan. Yes.
Are you planning to engage users into labeling the data, the images that you have or not, or you're going to apply some kind of fuzzy logics or some other techniques, extracting metadata, doing something around these metadata?
The idea that we have so far is not including anyone. We want to be as autonomous with the algorithms as possible, just because of initially that's our mindset for working. We're a small company, small resources, so that's our initial idea. But the reason why we're looking to foster these collaborations is because we know that in these particular aspects you know way more than we do. So that's one. Our plan right now is not to include any user, but if we are working in a particular collaboration agreement with an institution and say this is the way that it should be done for this reason, then we include them. But right now we don't do math with things that we don't have. So.
How do you manage the rights for the images that you have, or how do you kind of collaborate through data sets from multiple countries, multiple regions, multiple? So how do you manage these aspects that were just under discussion?
So what we do so far is we develop a product, we ship it to everyone through the distribution channels that we all know, app stores, for example. It's a free app, and we promote it within the medical community of different countries. The images that we have are de-identified images, because this is what our application does that no other application does today. We give you as a physician the tools that you need in order to de-identify and classify the image easily before sharing it. So what we get at the end is a de-identified image that when the user comes into our platform agree that we can use it. So there's acquiring content easily, and then we can just start using it right now after that. To this day, InsightMedi is just collecting. So we're in the part of collecting this information, and what we want to do now is get into the part of processing the information. The idea that we have for the future is to create an assisted diagnosis service that any user from any part of the world that has a smartphone can just upload a group of images and then ask for a diagnosis that will be calculated on the cloud. But obviously, we need to do more in terms of acquiring the data in order to be able to train these algorithms. But acquisition is just like that.
Okay. So what if the 5-year-old girl on the video, what if her mom finds out and goes to your company and...
No, in the case of the video, it's a completely different thing. The video is something that we are not storing or producing. This is a partnership with a company from the US called RealDX. They have the secure platform that is HIPAA compliant, and they do everything that has to do with the video. Our application is just a window for that content. So we want to, the idea when I was presenting the product, the idea is to say our core is medical images, but we're always looking out for value. So we know the video is valuable for education purposes, for example. So we partner with this other company, and then we provide access to that library. But we're not responsible for that company, and I know for a fact that every video, the first thing that you see when you watch it is the parent giving consent to the camera.
So they're responsible.
Yeah.
Okay.
What about images, if there is a face of someone, let's say, or something like that, so there should be some kind of consent from the user, I guess, provided by the physician, like before uploading or something like that.
In our case, in our platform, there are no faces. You have to, we give you the tools. So when you select, let's think of Instagram, which is a very similar model. Now you take a picture of your lunch or the sunset, whatever you want to share, and then you select a filter to make it look more professional. In our case, InsightMedi, you do the same. You take a picture, you select tools to de-identify your image. We don't help you make it look more professional, or not only that, but you have to remove the faces. One of the things that we want to do with these new techniques that we're planning to apply is to do face recognition, of course. But not because we need a face to be in our image and with consent. It's because we want to help the user go through the classification process easily. So we're going to detect the face for you, so you don't have to do it manually. But there's no, the way that our content is approved on the network, that's why our doctors have that role, is there is moderation. So if you send a picture with a face, that's never going to be live in our network. It's going to be deleted.
Or something.
Yeah, anything that could be used to identify a patient is not going to be ever live in our platform.
And when you talk about deep learning, how are you envisioning to incorporate this? Because you have said you have labeled data, or you don't have labeled data?
No, right now the whole idea behind deep learning is applying, creating the algorithms, we don't have any of that. What we have is the images right now that are coming to us every day. We're this database that is ever growing, right? So we know that that's valuable, and we want to create deep learning algorithms just to use our images to train those algorithms. Our images are very particular in the sense that they are not coming from, we're not buying it from a source. We're getting them from all over the world. So they are very rich in the way that they are different. So the same kind of mold you have in different skin conditions, skin tones, like from all over the place. So what we want to do is to apply, use these images to train the algorithms that we're going to apply, and use fuzzy logic and deep learning as techniques to enhance the image and then be able to extract information from it. And our goal is to create a diagnosis service.
Okay, so in your case, you're saying you have this information behind the picture that this is a mole. This is part of the dataset? Do you know?
Yeah.
So it's labeled in some sense then?
Every user has to classify the image, but we cannot always trust that, because it shouldn't be, but it could be. So we're planning on using these algorithms also, everything that we can do with machine learning techniques to tag and get information from the image itself and being able to classify it. Our idea is to, short-term plan is to be able to detect faces and to be able to classify the image, at least part of it, for the user, so you don't have to use it. We're trying to compete with just WhatsApp, selecting and sharing it in a group of doctors. This is illegal. If we have to do 10 steps for the solution that we're providing, that's not a solution. So we're going to use it in order to make it easy, to make it faster, to work for them, and then hopefully also use it to analyze and feed the algorithms to train. Sure.
There's a couple of other competitor apps in this space that are aggressively marketing towards doctors and healthcare professionals. What is it in your product that is different or unique that makes us go with yours rather than one of the other competitors?
Well, I would say a couple of things. Our biggest competitor is a company called Figure One from Canada. They are all only focused on or mainly focused on the English-speaking countries, and they are not giving any flexibility or they're not making it easy for the users to forget about the language limitations. This is a huge difference, because InsightMedi from the get-go was global, and what we have in our platform is translation features that are going to make you forget about the fact that you don't speak one language or the other. So that's a big difference on the product side.
Okay.
But really, now we're focusing more on the business side, which is the institutional side. For example, we just shipped a product, a version of InsightMedi for the School of Dentistry in Temple University in Philadelphia. And while the competition is going doctor after doctor, which we are also doing, we're now trying to foster collaboration with institutions because we want to grow faster. So we want to get faculty, we want to get students, and we want to get images too.
Okay, so you're basically looking for mathematicians, statisticians
Exactly.
to complement,
Yeah.
to get information out of your database, basically.
To put it in a nutshell, we have a stable platform that is a channel to distribute everything we do and put it into real people's hands and then measure it again. If you have all the part of everything that has to do with creating the algorithms, doing the math behind it, crunching the numbers and the images, and that's where it stops, then we come in and we put it in the hands of thousands of people, and then we give you results. So we have that, that's the synergy, that's the industry academic part. This is what we offer.
Okay, if there are no more questions, let's thank Juan again.
Thank you.